I've got a bone to pick with overprescribing of testosterone replacement therapy in Australia because it's making young men infertile. I'm Melissa Hadley Barrett, a sexologist and a nurse practitioner from Restorative Health Clinic in Western Australia. Our focus is men's health. This video is a public service announcement for the blokes that are considering testosterone therapy or are already using it. The number of blokes coming into our clinics who are suffering from the shattering side effects of overprescribed, misprescribed or self-prescribed testosterone replacement therapy has been increasing at a pretty concerning rate over the last few years. These poor guys have seen the deceptive online ads and news headlines for TRT that say it's the magic bullet for low energy, sex drive, mood or muscle strength. Even the Wall Street Journal ran a piece in September about online clinics offering TRT, claiming broad health benefits like heart disease, preventing diabetes and all sorts of things. I believe testosterone replacement therapy is a great treatment for certain conditions and also for particular patients. But it isn't for everyone. It wasn't the right treatment for these poor guys who have come into Restorative Health Clinic looking for help with the unexpected side effects after they started TRT, without undergoing any essential medical tests to confirm they actually had low testosterone. As a result of TRT, many of these guys are irreversibly infertile. Many of them are young guys in their 20s and 30s who will never be able to biologically become fathers. Having to break this to them is absolutely heartbreaking. It made me feel so angry that they were misled by licensed medical practitioners who are abusing their positions of power to turn a whopping profit. Some TRT clinics charge patients thousands of dollars every year for a medication they don't need, and it's doing more harm than good. It's also important to note that if you actually do require TRT, it shouldn't cost more than about $80 a month at the publishing of this video. The bare minimum for comprehensive testosterone level testing in Australia is a fasting blood test, taken before 9 AM along with a full hormone profile. The reason extensive testing is essential is, for example, a man may have low testosterone because they have a brain tumour, and to rule this out, we need to check their prolactin levels. This is a very rare problem. However, if a man is incorrectly prescribed TRT, it could delay diagnosis of the underlying issue, resulting in a life-threatening condition. Another example, which is much more common, that we see at our clinics is men taking TRT to increase their muscle mass, usually encouraged by deceptive online ads that fail to mention the side effects of having too high testosterone levels. On top of fertility, there are other side effects from testosterone replacement therapy when guys don't actually need it. Testosterone can thicken your blood. That's called erythrocytosis, try saying that with a couple of beers, which raises the risks of clots, stroke and heart attack. It can cause high blood pressure and worsen heart failure. When you take extra testosterone, your body stops producing it naturally. That means sperm production shuts down, sometimes permanently, and the testes can shrink. Men might also notice oily skin, acne, and for men prone to baldness, their hair will fall out faster. Excess TRT can enlarge the prostate, leading to urinary symptoms, and you'll need regular PSA checks to keep an eye on your prostate health. Some men feel more irritable, aggressive, or experience mood swings, especially if their testosterone levels fluctuate between doses. The biggest problem is that it can mask the real cause of your symptoms. Fatigue, low libido, poor erections are all often due to sleep apnea, stress, depression, medications, thyroid issues, or a combination of lifestyle factors. If guys are led straight to testosterone replacement therapy when it's not medically necessary, the real causes of their symptoms may go unnoticed and untreated. To summarise, testosterone replacement therapy is a medical treatment for men with proven hypogonadism, confirmed by symptoms and low-level testosterone on blood tests, confirmed twice. It is not a lifestyle booster, and it is not the fountain of youth. Please don't believe the misleading ads you see on social media or that random guy at the gym you sometimes chat to. If you're considering TRT or you're already trying TRT, I urge you to get a second opinion. It may well be the right treatment for you, and that's great. But unfortunately, there is a clear trend of overprescribed, misprescribed, and self-prescribed TRT. At Restorative Health Clinic, we only prescribe testosterone when it's truly needed, after completing the necessary tests, and we carefully monitor your blood pressure, blood count, and prostate health during treatment. Even if we aren't your first choice, we hope you'll see us for a second opinion, because we'll ensure that it's the right one. Our expertise is accessible to men worldwide via telehealth appointments, and if you live in Western Australia and would prefer an in-person appointment, we have clinics in Perth, Vass and Albany. Please visit our website rshealth.com.au to book your telehealth or in-person appointment today.